Good afternoon, everyone. My name is Adam Del Molino, and I'm the Senior Director for Virtual Care and Clinical Affairs here at the Massachusetts Health and Hospital Association. Welcome to today's webinar, HPC Finalizes New Material Change Notice Regulations, What Healthcare Organizations Need to Know. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2026 annual sponsors and strategic partners for their support in underwriting today's webinar, which is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues like changes to the Health Policy Commission's material change notice regulations. I'm now pleased to introduce our presenters from Robinson and Cole LLP and the Dana-Farber Cancer Institute. Connor Duffy, partner and co-chair, Health Law Practice Group at Robinson and Cole, and Jamie Flaherty, Assistant General Counsel at the Dana-Farber Cancer Institute. Connor and Jamie, thank you for being with us here today, and I want to now hand it over to you to get us started.
Great. Thanks so much, Adam. Good afternoon, everyone. We really want to thank you all for joining us today. We're really excited to be able to speak today on this topic and really appreciate everyone attending. We also wanted to thank the MHA for hosting and for all the support that Adam and the team have provided for us in getting this organized and set up and putting it on. We really appreciate it. Similarly, we wanted to thank all the sponsor organizations and those business partners of the MHA who make this programming possible and who support all the great programs that the MHA puts on each year that are of such benefit to everyone. As I said, I'm Connor Duffy at Robinson and Cole, a partner in the healthcare group, and I'm joined by my colleague Jamie, who I'll let introduce herself.
Yep. Hi, everybody. Good afternoon. My name is Jamie Flaherty. I'm an assistant general counsel at Dana-Farber, and I'm glad to be here today and hopefully offer a helpful in-house perspective on some of these changes.
Thanks so much, Jamie. So we can move ahead. So initially, just a reminder, a disclaimer, particularly for this topic that's so new and we're all still working through it. Just a reminder, this is intended to be an educational program today. We are hopeful and very open to all of your perspectives as market participants. And we know there are a lot of people in the audience today who were involved in development of the regs and who played, essential parts in providing feedback and helping the HPC to develop the final regs. And so we'd love for your questions and are open to feedback. But just a reminder, this is educational and not a legal presentation, as you all know. Next slide, please. So just an overview of what we'd like to cover today. We're going to start with a little bit of background and talk some about the 2025 legislative changes in Massachusetts that led to these updates in the material change notice regulations. Because as we'll talk about, they really follow them pretty closely. And, I know at least in my experience, January 2025 already feels like a long time ago. And some of the developments in Massachusetts healthcare in connection with the Steward healthcare activities suddenly can feel like a long time ago, but also yesterday. And as we'll see, that informs a lot of the changes that have been proposed and that were finalized. And so it's important background and context to consider as we move through. From there, Jamie will kind of lead the overview of that process of updates to the material change notice procedures and the regulations in 2025 and 2026. Looking at some of the guidance, the proposed changes, the final regulations, and the process that was followed, and some of the key changes that were made, including in response to feedback from some of you today on the program. We'll then look at some of the impacts and recent trends since the changes in the material change notice process, including based on the guidance last year and then more recent filings. And then we'll open it up to questions. And, we posed some of the questions that we're encountering and seeing, and would love to hear from participants today on some of the questions you may have or the issues that you're seeing for discussion. So next slide, please. And we can go to the next slide. So as a reminder, in early January of 2025, an act enhancing the market review process was signed. This is also commonly referred to as Chapter 343 of the 2024 legislative session. The goals of the act is really an immediate response to the developments with Stewart in Massachusetts, and then how that process played out at a kind of from a regulatory perspective in the Commonwealth. And so that act was signed on January 8th, 2025. And, as stated here, some of the goals of the act, including, strengthening oversight of new market participants and, entities like private equity investors and other equity investors who become more involved in healthcare since the original passage of the HPC statute in 2012 and the passage of the material change notice regulations in 2015 that had been in place to date, and also to expand some of the enforcement and oversight scrutiny powers of state regulators, including the Attorney General and the HPC, as we'll talk about. Similarly, I think it was intended to fill gaps or perceived gaps in the regulatory oversight that had led to proliferation of some for-profit healthcare entities and private equity ownership, and the experience that the Commonwealth saw with those facilities and what happened and how that played out. So as noted, it expands the authority of a few state agencies that we'll go into in more detail. Today, we're going to focus specifically on the HPC, as you might expect, but do note that those other agencies are also affected by the statute and by some of the regulatory processes that have commenced since then. And as we said, it really is focused on expressly expanding some of the oversight and enforcement authority and requiring more notice, more disclosure along the lines of, sunlight as the best disinfectant for regulatory oversight of the healthcare market in Massachusetts. So next slide, please. So how did it literally happen? It's important to really consider the text of the 2025 of the statute in Chapter 343, because as we'll see, the regulations actually follow the statutory changes pretty closely. And in some cases, even that we'll talk about, the regulations are even a little bit narrower than the wording of the statute, which is kind of notable and is something the HPC commented on earlier this year when they were finalizing them. But the statute establishes new definitions for certain entities that are involved in healthcare market, including private equity company, significant equity investor, and also expanded what the HPC calls the triggers, or the regulatory thresholds at which a material change notice is required. And so, as we'll talk about, previously there were essentially 5 triggers. That's been expanded to 9. And the subsections and subparts of each of the triggers, a number of them have been expanded, including to incorporate prior guidance on things like clinical affiliations, which we'll talk about. And so the collective impact is to significantly expand the circumstances in which a material change notice is potentially required, as well as the types of parties who are subject to the filing requirement. And similarly, on the back end and the analysis and the cost and market impact review, the CMIR process, there's an expansion of the authority to both ask more questions and probe more deeply at the outset, and then to continue monitoring and receiving information after the receipt of a notice and the transactions proceeded, and not just on filings or transactions that were subject to a CMIR. So next slide, please. So how specifically was the authority expanded under the Act? So as we said, there's new definitions, in connection with healthcare market in the Commonwealth, and particularly related to private equity operations, including a healthcare real estate investment trust or a healthcare REIT, a private equity company, a significant equity investor, and an MSO or management services organization. I think one notable piece here is to kind of look specifically at the definitions and what is included and what's not. As we'll talk about, and as everyone knows, the process under which you analyze whether material change notice is required has always been complicated and required a really close reading of the regulations. It's only gotten more complicated as a result, and it's incredibly definitional in terms of requiring specific analyses of each of the defined terms and how they play together. And that obviously makes it difficult. and is part of the challenge in assessing transactions and whether they implicate these regulations. It's only gotten more so with the addition of more HPC material change notice triggers and more definitions, and particularly concepts like private equity company that all of us hear every day, but is a little bit harder to kind of define really what that means in practice. And so it's really important to consider closely what that definition that they settled on is, and how that impacts your operations and potential arrangements and transactions. Similarly, it's important to keep in mind that significant equity investors is a similar concept, but it's not just private equity companies, and can expand more broadly for those 10% or more interests in a provider organization or an MSO. But each has carve-outs, for example, for venture capital firms, which is not separately defined. And so, is another interesting element to consider. And then the MSO concept is something that, has become so prevalent in healthcare and is newly defined in part of the regulations now as a result of the statute. So next slide, please. So how is the authority expanded specifically? So one of the things that the statute looked at and commanded there to be material change notice filing to the HPC is more types of arrangements. And so that would include, something we're going to talk about a lot, which are significant expansions in a provider or provider organization's capacity, as well as transactions involving a significant equity investor, which result in a change of ownership or control of a provider or provider organization. Also significant acquisitions, sales, or transfers of assets, including real estate, sale leaseback arrangements. That was something that was seen in Massachusetts, Connecticut, and some other states in connection with some private equity and for-profit ownership of hospitals, and something that was a big part of the disposition of those assets at the back end in the bankruptcy process. And so it was something that received a lot of coverage of the way in which real estate assets were sold to related or unrelated organizations, and how that process worked and sort of averted potentially regulatory scrutiny at the time, only to be discovered later. And so we see, an immediate response to that in the form of this statute, and additional oversight of those types of transactions. We'll talk about it a little bit more, but the really interesting aspect of this is, in the statute itself, it says including without limitation real estate sale leaseback arrangements, which is suggestive that they want it to reach further into different types of significant acquisitions, sales, or transfers of assets by providers or provider organizations, which, as you can imagine, is incredibly broad. And, Jamie will talk about one of the pushbacks on some of the regulations was inclusion of language like included but not limited to. And, that's, I think, a challenge and an open question that we'll get to is what additional types of transactions could potentially be subject in the future to material change notice filings. Similarly, conversion of a provider organization from nonprofit to for-profit status now requires it's a separate trigger requiring a material change notice filing. Transactions that exceed updated reporting thresholds for mergers or acquisitions, the 10 million revenue increase, 25 million filing threshold of the past is now going to be updated annually tied to inflation, which I think is a welcome update for market participants. And then, the HPC, as talked about, has authority to identify additional types of arrangements that could potentially be subject to, material change notice filings. Another one, not listed here, but additional types of transactions involving providers and provider organizations, as well as carriers or health insurance companies, is a notable inclusion and the one that we see in the regulations. Next slide, please. So how did the HPC and Attorney General authority expand under the Act? I'll kind of run through this because we really want to focus on the material change stuff, but certainly there's an expansion in some of the cost trend scrutiny and processes, as well as additional data being collected as part of the RPO process. In terms of the CMIR process, directly related to material change notice filings, there are additional opportunities for the HPC to request information from entities involved in transactions, or including the parties and parents and equity investors to a transaction, including on things like capital structure, financial condition, ownership management structure, audited financials is a big one, an interesting question with respect to, if they're for private companies, whether or not they maintain the type of audited financials that would be expected by the HPC. That next one is really notable, I think, is that the HPC can continue to require post-transaction data for up to 5 years after a material change notice is submitted. And note that it isn't tied to a CMIR review conducted by the HPC, so it's potentially more broad. And then the Act did expand the factors that the HPC will consider as part of the CMIR, including, size and market share of affiliates, healthcare and resources inventory, and related data or reports from OHRP. Next slide, please. So I just want to level set, and I'll turn it over to Jamie to get into the proposed regs. But as a reminder, what are we ultimately talking about is, for about 10 years, from January of 2015 until early 2026, when the regs were updated, there were essentially these 5 triggers that led to a material change. And notably, the requirement was part of the definition of a material change in the regulation. So, we're going from 5 triggers to significantly expanded regulatory regime. And so I'll turn it over to Jamie, but just wanted to provide that reminder to level set.
Great, thanks, Connor. And we can go to the next slide. Yep, so now I'm going to start walking through the process and actually, the proposed regs themselves. So we can go to the next slide. So this is just a timeline. Thought it might be helpful to include this slide to give a bit more context as, to how we got to where we are today with these new finalized regs. Right, so Connor just kind of walked through what happened with the statute. And then HPC issued an interim bulletin implementing certain changes stemming from the statute prior to the issuance of regs while they worked on developing the proposed regs. We'll walk through those, that bulletin and the proposed regs themselves in the upcoming slides. As Connor mentioned, in many ways, it just sort of stems from the statutory language itself, but we'll kind of, again, walk through in more detail. Then in February, HPC published the proposed amendments and welcomed public comment on them. On April 16th, 2026, HPC had their board meeting and actually walked through very helpfully a number of the public comments they received and then voted to approve the proposed amendments. Keeping many things, but also implementing some changes based on the comments they received. I will say again that HPC board meeting is available on YouTube, so folks can watch that. It's very helpful. And again, I thank the HPC for their willingness to accept comments and walking through those. It was a, that presentation was really helpful, at least to me, to kind of understand the agency's thinking on that. Dana-Farber, of course, that's where I work, but wanted to share, we also actually shared some proposed comments on the regs themselves. We had just gone through a pretty rigorous process with DPH and HPC, rightfully so, for our new 300-bed inpatient hospital and our proposed new collaboration with BIDMC and with HMFP. So these processes are pretty top of mind for us. So we felt we were in a particularly suitable position to share some thoughts on, the proposed regs and just try to make sure, they work for the regulated entities as well as the agency. I would say, again, other entities shared really helpful comments as well. I think MHA did, as well as BMC and other entities. Some of the common themes of the comments, folks were generally supportive of the goal behind the proposed amendments, particularly, like Connor said, in the wake of the Steward Healthcare bankruptcy and just generally what's going on with private equity. But we just flagged, as did others, pretty broad in certain places. Again, this use of including but not limited to in several sections, which as lawyers, of course, as a drafting technique, you can understand how that's helpful to include, but for a regulated entity, it leaves a lot of open questions. So we had flagged that, and HPC did eliminate, that clause in certain sections. Some folks, flagged concerns about the duplicative data requests, the process for a DPH determination of need, independent cost analysis, and the data request there. And then separately, HPC's own cost and market impact report process. And the board meeting, HPC acknowledged, some of the overlapping elements, but emphasized, that they are distinct processes serving distinct policy purposes. So in many ways, kind of retained HPC's own CMIR, processes. And again, just from our perspective, right, more types of transactions triggering MCNs result in lengthier processes, including with the 5-year post-transaction review, just, increases some regulatory burden and uncertainty. And we had flagged, concerns that these could, chill or delay beneficial arrangements that we view as critical to patient access and promoting patient care. And then I would just say the HPC updated or posted an updated notice of material change form, essentially the same, but included new checkboxes for entities to select the applicable type of material change category, which again had been updated to include these new category types. So we just wanted to flag that for folks. And would note it keeps that affidavit of truthfulness at the end from an operational perspective. Again, keep that in mind. People who are filing these, we have to get, that signed and go through the process to make sure who's ever signing that is comfortable. And then lastly, just flagging, HPC also posted a guidance document that's available on their website. It includes more detail on some of the core definitions, calculating net patient service revenue. It goes into transactions with out-of-state entities, which is something honestly we've grappled with, and a couple other specific categories. So again, we just encourage people to review the HPC website. There are helpful guidance, and the regulations, of course, themselves are posted there. If you could go to the next slide. So as we mentioned, right, in the interim, the HPC was working on developing these regs. They released this temporary guidance. It's now been superseded by the finalized regs, but we just wanted to include a slide on it for additional context. Again, mostly just kind of follows the statutory language, lays out the expanded categories of material changes, including significant expansions in capacity, transactions involving significant equity investors, this leaseback arrangement, new category, and conversions to for-profit. And then again, also address the expansion of parties from which HPC can request information. Went into some of that detail on how HPC has expanded authority to collect information from significant equity investors. And then also underscored that HPC will keep confidential non-public information and documents obtained in connection with an MCN or a CMIR. I would flag, though, and we'll get into this later, that language has since evolved in the finalized regs, and would encourage folks to review the confidentiality provision at 7.09. If we could go to the next slide, please. So the proposed regs themselves, and the next couple slides, we're going to walk through them in more detail. I would just say, though, for all of us who are trying to parse what was new and what wasn't new, it was hard because there wasn't a red line. So not really much for me to say on that, other than I feel your pain for people who are trying to sort of figure out what was new, because again, the formatting changes as well, the changes to the definitions, it made it a bit tricky to kind of, again, figure out what was changing in these proposed regs, but hopefully this presentation helps with that. So we can go to the next slide. So a lot of this, we'll kind of be repeating because so much stems from the statute, but at least for myself, these regs are, as Connor mentioned, pretty hyper-technical and definition-based. So I think kind of going over and over again actually helps with some of the information sticking. So with respect to the filing thresholds, as Connor mentioned, those used to be set. Now they're subject to yearly adjustments. The adjustment will be based on the Personal Healthcare Overall Index published by HHS or a similar healthcare inflation index. So just keep an eye out in future technical bulletins for those adjustments. Again, incorporated these new statutes largely from, these new definitions largely from the statute. Control, though, the definition of control is a newly added definition that we wanted to flag for folks, as well as the proposed regs added pharmacy services into the definition of healthcare services. So, that expanded the type of transactions subject to review to include pharmacy transactions. And then again, definition for management services organization from the statute, and minor changes to the NPSR definition with more detail spelled out in the associated guidance. And again, right, kind of broadens the transactions considered a material change, including increases in capacity, including those that would require a substantial capital expenditure, DON. One thing we had flagged, and I think maybe others had commented on, is the proposed regs explicitly said that that this would include proposals that could be filed under an emergency DON application. That's something that we flagged as concerning because, again, having to go through both of those pathways could eliminate the whole sort of point behind such an exception and the whole utility of the emergency DON pathway. So that's something we had shared comment on and actually was changed, taken out in the finalized regs. The increases in capacity category still remains, but they took out this language about including explicitly emergency DON applications. And again, in these proposed regs, with respect to increases in capacity, they use the phrase including but not limited to, which we had also commented on because it's just unclear to regulated entities if it would include other types of transactions, and if so, or other increases in capacity, and if so, what those might be. And again, they also took those out and they tweaked that a little bit to make it a little bit more clear in the finalized regs. Okay, and then we can go to the next slide. So as we've already mentioned at a high level, the proposed regs added new grounds for CMIR and a new process for initiating a CMIR, as well as incorporated from the statute the additional factors to consider when conducting a CMIR. So in terms of the grounds for conducting a CMIR, codified the existing grounds, namely if the HPC determined that the material change would be likely to have a significant impact on the Commonwealth's ability to meet the healthcare cost growth benchmark. But it added this new ground for requesting a CMIR, which is that if HPC finds, based on CHIA's annual report, that a provider's percentage change in total healthcare expenditures exceeded the healthcare cost growth benchmark in the previous calendar year, that's a new reason why HPC could request to conduct a CMIR. And then the new factors include those set out in the statute, so the size and market share of any corporate affiliates or significant equity investors, inventory of healthcare resources maintained by DPH, and any related data or reports from the Office of Health Resource Planning. So again, just directly from the statute. We can go to the next slide. So the proposed regs themselves really laid out, these kind of expanded categories of MCN triggering transactions. In particular, so a lot of these ones listed here existed before, and Connor has that slide earlier on of kind of how the regs used to read. It largely looks the same. It's just, added a little bit more detail, but in particular with respect to the third bullet, it expanded the scope of covered transactions to include certain affiliations involving providers and provider organizations and entities representing out-of-state healthcare providers. So this is where the out-of-state entity question comes up. And again, previously HPC guidance had said that a material change involving a provider or provider organization and an out-of-state entity may require the filing of an MCN, and directed entities to actually contact the HPC with any questions. Now, as proposed in the regs, there'd be implications for any acquisition, merger, corporate affiliation, or contracting affiliation with an out-of-state entity representing providers of healthcare services, where such transaction would result in an increase in the NPSR equal to or greater than the revenue increase threshold, which again is $10 million. Again, just in color commentary, this is an area where Dana-Farber provided comment. We were a bit concerned about this section and transactions with out-of-state entities as proposed being overbroad, and candidly questioned HPC's regulatory authority over out-of-state affiliations based on the statutory authority provided by Chapter 343. Out-of-state patients are excluded from the HPC's need assessments and market analyses, yet these affiliations would require MCN review. So we were just, we felt that it was overbroad and flagged again that it could have a chilling effect on important clinical affiliations, especially, for us, a specialized cancer center, regional affiliations we have with out-of-state community hospitals are essential in our view to ensure sufficient patient access. So again, in our comments, we just shared that we felt mandatory MCN review of these out-of-state affiliations could deter really beneficial partnerships without corresponding benefit to the Commonwealth's healthcare market. And then the proposed regs also had some changes to the clinical affiliations category. Some commenters shared that, that category was overly broad. HPC's take was that approach in the language really isn't new and it reflected the current practice. Specifically, they explained that the proposed regulation codified the HPC's 2015 guidance, which had, this detail about co-branding, co-located services, et cetera. So that was sort of their take on it. And it's true, that those sort of different those factors about co-branding and et cetera were addressed in the guidance. But we'd note that the guidance also had this language about HPC only expecting to receive notice of strategically important clinical affiliations and not routine non-strategic clinical affiliations. So we're still kind of wondering whether, how to interpret this new language based on that past guidance and specifically how broad really to interpret that clinical affiliation category. We can go to the next slide. And then about the CMIR processes, again, the proposed regs followed the statute and added this language about, who HPC may request information from. The prior regs had some language about information requests, but this added kind of new information about who HPC can request information from and just more detail regarding information requests. And then, from that perspective, would just add that, of course, can add some time and complexity if there can be more robust information requests and that HPC can request more information from different parties. And then on the post-transaction review, so I would just say generally on timing, under the proposed regs, timing generally remained the same, which is that, an MCN must be filed not fewer than 60 days before the proposed effective date of the proposed material change. However, the proposed regs suggested or required that the notice of material change be filed concurrently with a determination of need application. This is an area, again, where Dana-Farber shared comment. We just felt that requiring simultaneous material change notice and DON filings was just operationally impracticable. We honestly would love to be able to do those things at the same time, but just with the various levels of people who have to review and sign off on those different types of projects and planning timelines and just different, it just makes it really difficult to actually file those things at the same time. They wound up changing this slightly in the finalized regs, but this is certainly an area where we were kind of concerned about that proposed timing change. And then on the post-transaction review itself, we've already talked about this, but HPC could require for 5 years that the entity involved in the material change submit data and information necessary for HPC to assess the post-transaction impacts of that change. So it stems from the statute, but and laid out just in a bit more detail in the proposed regs themselves. And then, clarified that HPC can report on the result of its post-transaction review and make referrals to other agencies based on the results of that post-transaction review. And then I think Connor's going to take it with respect to the actual finalized regs.
Great, thanks so much, Amy. Yeah, so as you all know, and as we talked about in April of this year, the HPC had a public meeting and approved the amendments to the MCN regulations, and those then went into effect on May 8th, 2026. As Jamie noted, they're available Google or on the HPC website. But do be careful when looking at the regs to make just at the bottom of the page to make sure you have the May 8th, 2026 version because the January 2015 version are still proliferating out there. And obviously, there's a number of significant changes, including to the material change notice form. As we talked about, the finalized amended regulations are largely consistent with the proposed regulation, but they do have a few key changes. And it was pretty clear based on the HPC's comments that those were influenced by stakeholder comments. And the HPC, during that meeting repeatedly expressed appreciation for commenters and stakeholders for providing their input, including where language was potentially duplicative amongst the triggers, and also flagging areas that the regulated entities had concerns about ambiguity or uncertainty in terms of the requirements. So, as we've talked about, there's the new material change notice filing threshold framework, annual adjustments tied to inflation for both the filing requirement, currently at 25 million and subject to increase, as well as the revenue increase threshold, currently at 10 million, which is both consistent with prior practice, but will change in the future. Those new investor categories that are subject to the material change notice filing requirement, and as we will talk about in a few minutes, we've certainly seen that impact already in response to the 2025 acts. The expansion of the triggers for material change notice in terms of transactions up to 9, including the ones that Jamie went over. Those were finalized, but with some important wording tweaks in there. Expansion of CMIR authority for the HPC, I think a really interesting issue Jamie brought up is where that healthcare growth benchmark is exceeded, and there's now an opportunity for the HPC to conduct a CMIR, whether that CMIR would be conducted in the absence of a material change or if it's only for an entity that goes through a material change and also exceeded the cost growth benchmark, and what it would look like in the absence of a material change is, I think, an interesting question that remains to be seen. Similar to the information requests, as we talked about, sunlight is the best disinfectant for these transactions and for the Commonwealth's oversight and regulatory goals. That post-transaction review authority and the ability to make referrals to other agencies in the state that did occur before, but it certainly is expanded here. And a clarification in terms of the material change notice filing timing that Jamie just talked about, that practically is important for all of us who are running around trying to get signatures and approvals and the rest of it to get everything filed and submitted to the state for these big projects. So next slide, please. So this table, and I think will be useful. I believe we're sharing these slides, but it is kind of just a useful kind of in-depth review of exactly kind of what proposed and what changed. So the amended final regulations clarify the scope of certain transactions that are already subject to the material change notice process. In the proposed regs, there were mergers with or acquisitions of hospitals or hospital systems, but also mergers with or acquisitions of a provider organization by hospital or hospital system. That second reference was removed as potentially duplicative across 2 of the triggers. The HPC expressed appreciation for people flagging that as a helpful comment. As Jamie talked about, the out-of-state provider representatives and the treatment of out-of-state entity involved transactions continues to be a little bit of an open question that we'll get to, but there were changes made to the final regulations to try to narrow down the scope of that. And importantly, a large part of the guidance that the HPC issued in May in connection with finalizing the regulations is also trying to speak to their view on the out-of-state transaction issue. And so it's, I think, a really worthwhile source as well to confer if you're in that position, understanding there still, I think, are some of the questions and concerns that Jamie voiced before. But here, that is an important carve out in the regs clarifying for certain, arrangements that a material change notice is only going to be required if a proposed transaction is with or on behalf of a Massachusetts provider organization, or MSO involving an out-of-state entity and potentially engaged in contracting. In terms of the new transactions or triggers for the MCN review, as we talked about, that new statutory trigger of significant increase to a provider organization's capacity. They narrowed down the requirement related to the DON, and including to remove the but not limited to, and reduce to only where the capacity increase requires a DON for substantial capital expenditure. And then there's a second sub-trigger there, an increase in capacity resulting in the NPSR increasing by the revenue increase threshold. So additional obligation there for organizations to kind of consider their projections and the revenue impact in connection with an expansion of capacity to consider if there's kind of a secondary basis on which the MCN filing requirement may be triggered. With respect to the real estate leaseback transactions, the HPC pulled back a little. So this is one where we talked about the statutory language itself is very broad and potentially very vague. That language in the proposed reg column essentially covers it, which was any significant acquisition, sale, or transfer of a provider or provider organization's assets, including but not limited to a sale leaseback arrangement. The final regulations invert this a little bit to require, for now, a material change notice for a real estate leaseback arrangement involving the real property where healthcare is delivered, but then to defer to the HPC to kind of provide further guidance on what other significant acquisitions, sales, or transfers of assets are going to be subject to material change notice requirement. And they noted that this was done in response to some concerns from commenters. That said, I think it remains to be seen how this is going to play out and whether, frankly, because the, sub-regulatory guidance is subject to less scrutiny from public stakeholders and commenters, how that guidance is going to play out and what the impact will be in terms of practically, what is this penultimate trigger going to require in terms of significant asset transactions, and how it could also change in the future, because obviously guidance is easier to change than regulations. And that MCN filing deadline, just I think an accommodation of the regulated parties and entities and providers in the state, and understanding that getting everything done at the exact same time is easier said than done. So I think that was a welcome minor change. So next slide, please. So we'll turn to Jamie to talk about some of the impacts from their perspective.
Great, thanks, Connor. Yeah, we can go to the next slide. So we included this slide, which I think is just sort of a helpful kind of overview of some of the key takeaways. But I would just add, as we've seen with these regs, very hyper technical, really kind of like Connor said, you really have to kind of walk through each category and subcategory. And it's a fairly detailed and fact intensive analysis. It always has been, but it just remains that, and maybe even more so now. So we kind of need a lot of clarity on the proposed transaction, including the relevant parties, the scope of activities, and at least for me, sometimes we as attorneys, or whatever the role might be, you might be asked, whether an MCN is needed, and usually you don't have kind of enough to answer that question. So I would just say, as sort of a practical tip or something I've been trying to do, and of course, because they say no presentation can be a real presentation without mentioning AI nowadays, I would say we at Dana-Farber have an internal chat GPT. So I've been trying to work with that to develop a decision tree to help equip, my team and the business strategy folks and other, key stakeholders, give them something to kind of help them walk through whether a proposed transaction would trigger a material change notice. Of course, not perfect things, if I ask it a different way, I get different results, but at least, it's given me kind of a helpful decision tree that I can share with folks. Because then again, of course, with a lot of transactions, you'll hear, well, this is just phase one, phase two will include this. So the people who are closest to kind of the business arrangement, it's helpful to, for them to kind of understand these key categories and to do a first pass at trying to assess whether an MCN might be needed. So that's something, we're playing around with. And then just another kind of key takeaway is right timing. Just there's increased, kind of need to build in more runway for all of these things. Right, the notice of material change isn't deemed complete until HPC's received all the information it requested. Now that information requesting process, right, can be a little broader, so it could take more time. And then CMI, HPC has 30 days to determine if a CMIR, and if there is a CMIR and there's information request, that kind of, right. So all of these kind of things can compound. So all of us probably get asked all the time, right? How long will it take to get regulatory approvals? Well, it's just, it's getting harder to answer that question, but just need to kind of build in more time, particularly if a project is undergoing both a determination of need, independent cost analysis, and an HPC cost and market impact report at the same time. That could take well over a year to sort of go through all the various processes. So just making sure folks internally are aware of kind of these the steps we have to take and build in, time and game plan accordingly and prioritize projects and strategize accordingly. And of course, be ready to kind of share key documents and data in connection with information requests. Transaction implications, right? We mentioned the Attorney General referral. HPC has always had the authority to refer, its final report to the Attorney General. But I believe it's new in the regs that HPC can refer to the Attorney General if an entity refuses or fails to timely file a complete MCN. So we also just kind of wanted to make note, sort of broader ability to refer to AG and other agencies. So something for entities to be mindful as well. And I want to be mindful of time to give folks time for questions. And then just the last, bucket there, information requests. We've already talked about this, but right, more ability to sort of request information, including for significant equity investors, their capital structure, general financial condition, ownership and management structure, and audited financial statements. And would add that, they use that phrase sort of including but not limited to there. So it'll be interesting to see the types of information HPC ends up requesting for these types of transactions. And then I think that's all I had for this slide if we want to go to the next one.
Sure, yeah, and we'll get to the questions. We just want to kind of point out some of the recent trends already in response to this. So, as of last week, 6 of the prior 10, 12 of the prior 20 material change notices up on the HPC website involving ownership or control change involving a significant equity investor. Pretty remarkable immediate kind of change in the type of material change notice that's being filed. And I think what the HPC is receiving just in the past year, considering that this is an entirely new category or MCN trigger as of last year under the statute and just as of a few months ago under the regulations. And so already kind of seen a pretty, I hesitate to use for significant, but substantial increase in a new type of filing while continuing to kind of require the same filings that were before. So seeing more frequent filings, I think probably a larger burden for the HPC to parse through them. I think I don't want to, tempt fate for anyone in the audience or elsewhere, but this second bullet I think is something that we're all really interested in because it doesn't appear there's been a CMIR of a significant equity investor transaction yet, but you have to imagine that they are waiting and ready for the right one to conduct this kind of review and to kind of, try out some of the new enforcement authorities and oversight authorities that they've been granted under the statute and the regulations now that they've been finalized. And, I think just something that a little bit anecdotal, but there appears to be a pretty notable increase in filings by out-of-state entities, including parent entities in some of these transactions, including significant equity investor transactions and, some of the larger transactions that may be national level deals where there are local licensed providers in Massachusetts are now being caught, if you will, or triggering the MCN filing that may not have before. And so we thought that's pretty notable. So we go to the next slide. We just had these are kind of some open questions that are, have come up. Jamie had addressed the first one in terms of now are all clinical affiliations, what's the status there? We think is a really interesting one. And the second one, the circumstances for referrals, Jamie, I don't know if you have thoughts. I think it to be determined, I think, and then how to approach those significant acquisitions, sales, or transfers of assets while that guidance remains forthcoming. They talked a little bit, I don't think they want to be held to it, but the HPC representatives talked a little bit during the meeting earlier this year about essentially saying right now this trigger is sale leasebacks, but it's not always going to be the case. And, the statute does still cover more. And so I think it is a little bit of an open question and a difficult one. But certainly it covers those sale leasebacks, and for other kind of significant acquisition, sales, or transfers of assets, I think it's a little bit of a waiting game to see what else gets captured under that trigger and what other types of transactions that HPC may, is not already getting notice of that this could expand to.
Yep. Thanks, Connor. I agree. Yeah, I think some of these are a little bit of wait and see how some of these play out. Like you said, keeping an eye on trends and what we're seeing in terms of filings. But yeah, welcome. Of course, I'm sure other people have other thoughts, but these are some of the things we wanted to bring up and share with folks if helpful.
All right. So thank you both so much for today's presentation. Outstanding presentation. Really appreciated all the work that you both have put into this, and wanted to get to some of the questions from the members of the audience. And the first question came from Caroline, who said, "Great presentation. What is the expected timeline for HPC review going forward? And is that outlined for at all for different projects? With so many new material change notices necessary, how quickly will the HPC be able to act?"
Go ahead, Jamie, if you like. I think you started to talk about this, but I don't want to pin you to it if you'd rather either.
No, I would say I think it's a great question. I think it's something we're not we're not sure about, and that all of us are going to kind of keep an eye on, have sort of the same concerns. You increase the number of transactions triggering MCN review. It's, a lot for the agency to kind of take on. So it'll be, of course, we have a lot of the same timelines set out in the regs. So will be interesting to kind of see how the commission's able to kind of navigate that. I would say again, the timing in the regs itself there aren't any enormous changes, but there are those kind of, especially with the CMIR and the information requests, the ability to kind of add in more time for the allotted time for HPC to kind of conclude its final report. So to the extent entities can be ready and, have all their data and the underlying documents ready and can quickly jump on those information requests, that puts you in a good spot to, keep it moving forward. But yeah, it's true. It's gonna be a challenge, and it's a great question. Connor, I don't know if you have any other thoughts.
No, I completely agree. I would echo that. I mean, the only thing I'd add, and I hope this has been everyone's experience, and is, in the HPC encourages, right, people to reach out and in communication and dialogue, and they're always working in good faith, and they really do know healthcare, and I think particularly with their expanded information requests and authorities, they're going to be even more plugged in, and my hope is that that also allows them to know when something is not something that they need to linger on, and because they have limited resources, that for kind of the routine transactions or the straightforward ones and some of the clinical affiliations, et cetera, that those can pretty quickly be dealt with, as they have in the past, and there's not a significant kind of expansion or delay for, a lot of times things that, yes, they may now qualify as a material change, but in fact are a pretty routine clinical solution to an issue of delivering, the best care that a hospital or other organization can provide.
Right. It's a good point, Connor. It's, HPC, and we've experienced this with Dana-Farber, very willing to, kind of chat and discuss a transaction and weigh in, right? Because we don't want to overburden them, but of course, entities, right, want to file when they need to file. But it's certainly not just might as well file anyways, because there's a lot that goes into it, especially with post-transaction review. So it's just finding the right, making sure we file the right things when we need to, and not overburdening the agency, and do appreciate their, collaboration on making sure we get the transactions that they really do want to see filed.
All right, thank you both. Next question comes from Monique, and she asks, "Is there any risk for a retrospective review of recent, for example, within the last year, transactions that might need a material change notice?"
I'm happy to go first, and then Jamie, if you want. I mean, from my perspective, it unfortunately, as all lawyers say, it depends, right? But that, particularly within the last year, I mean, the statute has been changed now for a year and a half, and so there's been sort of a statutory obligation, of an expanded material change notice filing requirement. And there's also been a requirement to file, material change notice for 14 years now, and so, to the extent it falls within kind of the existing regime, which a lot of transactions already did, it certainly is something that you would have to look at. I think, that said, I, you know, no one could really rely on this, but I think the HPC has a lot on their plate looking forward as well. And so, that May 8th date is really something I would look at as that's a a point in the stand or a point in time at which you really need to make sure that your processes are up to date and you are flagging the need to make these filings in a timely manner.
Yep. I think that nothing really more to add. I would say sort of the grandfathering, and that wasn't really addressed in any of the regs or the underlying guidance, but I know that's something we were wondering when the proposed regs came out, with respect to, right, some relationships with out-of-state entities. Would those be grandfathered, or do we now need to file if it does hit that threshold now? So that is a question we also had. But right, for the retrospective review one, it's a good point about sort of when the statute came out. And it's a good question, but I think, yeah, kind of hard to see, hard to know where HPC will land on that, but I would guess probably mostly just looking forward. But yeah, hard to say.
All right, thank you. And I just want to open it up if there's anybody else that has a question, please feel free to enter them into the chat at this time. We'll probably have the opportunity for probably two more questions, I would say. Um, so a question that came in previously asks, does the new trigger for substantial increases in capacity related to the DON filing include the filing of a DON amendment for a significant change to a prior application?
Connor, do you want to take, you can
Sure.
take.
Yeah, I think this is a really interesting one. You certainly see a number of amendments being filed on prior projects, and it's kind of an interesting question of when an amendment could be a material change. I think the HPC addressed this in part at the meeting earlier this year. One of the representatives said in explaining the way in which they went about the drafting of that regulation and finalizing it, that they weren't intending to capture, as Jamie talked about earlier, emergency applications, or they'd made that change or amendments at this time. So, I would say based on that, it's no, and that they're looking mostly at applications for substantial capital expenditures, above that threshold. But that said, there's always, an exception with the expansive new definition of a material change, or the material change circumstances or triggers. I think it is certainly possible that a project that is the subject of a DON amendment that, for example, expands your capacity, in excess of 10 million net patient service revenue or something like that, could, arguably bring you into the realm of needing to file a material change notice under the new regulations.
All right, and then I think we have one last question that we can hit. And I think you might have covered this, but it's good. I think it's good to ask a question again because I think Connor covered it previously. But aside from sale leasebacks, what other significant acquisitions or sales of assets require a material change notice filing?
Yeah, I can start. It's a good question. It's something that kind of remains to be seen. So as written in the finalized regs, it's broad and it includes these significant acquisitions, sales, or transfers. And it seems like HPC will be releasing guidance on this. But in the meantime, right now, fairly broad and kind of unclear. As we've discussed, the statutory authority suggests, the focus is on leaseback arrangements, which again track kind of given one of the main catalysts for these regs, which is what happened with Steward. And in the HPC board meeting itself, I believe they had said that, they would be focusing more on real estate, the leaseback transactions. But for right now, I think just sort of remains to be seen. But Connor, if you wanted to add anything else.
Yeah, completely agree. The only thing I guess I'd add is there's no timing on this guidance, and so I wonder if, similar to the way that the statute and regs were a response to perceived gaps in the filing, if the HPC takes a little time to see what kind of transactions they're getting filings on, and are they still missing anything, or are there things they're interested in and want to know more about that they're not getting, this could be an opportunity potentially to expand that requirement to get those.
All right. Well, we're coming up on the top of the hour, and I just want to take this opportunity to thank you both, Connor and Jamie, for today's presentation. I know there'll be a lot of discussions today that our attendees will be taking back to their organization. So thank you both very, very much. As we are coming up on time, I also want to take this opportunity to thank you all again for joining us today for today's webinar. And please scan the QR codes on your screen now to see all of MHA's educational programming. In particular, I would encourage you to register and sign up for, if you haven't already done so, MHA's 2026 Annual Women Leaders in Healthcare Conference, which will be December 3rd at the Westin Seaport. That conference always sells out, so please register as early as possible. In addition to our MHA annual meeting coming up on January 14th, 2027 at the Westin Copley Place in Boston. Thank you all so much for joining us today. Really appreciate it and have a great afternoon.
Thank you. Thanks,
Thank you.
everybody. Bye.